Good afternoon, dearest viewers, and welcome to another Facebook Live session here at KL Fertility Center. My name is Marijn from GetDog, and with me here today is Dr. Paul, who is a fertility specialist here at KL Fertility Center. Dr. Paul, so glad to have this opportunity to speak to you.
Thank you.
Could you perhaps briefly introduce yourself to our viewers?
Yeah, sure. I'm Dr. Paul Tay. I'm based in KL Fertility Center here. Just a little bit of my background. I obtained my specialist degree in obstetrics and gynecology in about 1997, and I developed an interest in infertility and got myself a training post in Sheffield Fertility Center in UK in 1999 for 2 years. So that's where I acquired my basic fertility training. I also did a lot of research into luteal phase support, which is a big topic in infertility, and obtained my postgraduate research degree in 2001. After that, I came back to Malaysia. I left UK and came back to Malaysia, and I became an associate professor in University Malaya Medical Center in 2001 till 2007. During that period, I was heading the fertility unit in UMMC. In 2008, I decided to leave government service and join Prince Court Medical Center, and I was running the fertility center there until very recently. So overall, I have about 19 years of experience and done about 2,000 IVF cycles.
Wow, that's a long time in this field.
Yeah.
If I may ask, what is it that you enjoy so much about being a fertility specialist?
It is a very innovative field. Every few years, every so often, there will be something new came out. It is interesting. It is very challenging as well. But nothing beats seeing an infertile couple getting pregnant. So it's really, really enjoying.
It's really rewarding job.
Yeah, rewarding job, correct, yes.
Thank you very much for your introduction, Doctor. Maybe before diving into the topic of today, I'd just like to remind our viewers that should you have any questions, concerns, or whatsoever, all you have to do is just pop them into the comment box below, and Dr. Paul will be more than happy to address them during this Facebook Live. Moreover, should you feel shy and not be willing to pop a comment into the comment box, you can also send us a private message on our Facebook page, KL Fertility Center. With that having said, I'd like to dive into the topic of today, which is multiple births in IVF. What do couples want? Dr. Paul, could you perhaps first explain what IVF is and how it can help couples to realize their baby dream?
IVF or in vitro fertilization basically means fertilizing the woman's egg outside the body. Basically, eggs are retrieved from the woman's ovary, fertilize it with the partner's sperm, and the resulting embryo will be placed back into the uterus about 3 to 5 days later. That is a simple explanation, but of course, reality than that, it usually involves 5 steps. The first step is the woman has to go through a series of injections for about 10 days to stimulate her ovaries to produce eggs. The second step is to retrieve the eggs, a procedure called egg collection, where a fine needle is placed into the ovary to get all the eggs out. And the third step is to get the male partner. And the fourth step is for the embryologist to bring the egg and the sperm together, a process called fertilization that occurs in the lab.
Okay.
And finally, we will pick up the best quality embryo about 3 to 5 days later to transfer this embryo into the uterus to try to make the woman pregnant. IVF is by far the most successful treatment up to date. Yeah? When all else fails, when all other simple fertility treatment fails, IVF can work. Yeah? It works for almost everything like severe male factor infertility, bilateral blocked fallopian tubes, advanced maternal age, a disease like polycystic ovarian syndrome or endometriosis.
So IVF really still provides hope to those couples struggling with infertility.
Absolutely. Yeah.
Okay.
Yeah.
And in terms of IVF, what are the possible outcomes of IVF? Singleton, multiple births?
Yes, yes. Before to answer that question, perhaps I should go a little bit backwards to explain why IVF create multiple pregnancies. There's always this talk that oh, IVF will give you twins. Maybe let me do a little bit of explanation how it happens. Human embryos are full of chromosomal defect, yeah? And the embryo that we put into the woman's body doesn't always produce a pregnancy, right? So to give you some example, there's a terminology called implantation rate, which is defined as the number of pregnancy sac divided by the total number of embryo we put in.
Okay.
And a typical implantation rate for a day 3 embryo is about 25 to 30%.
Okay.
So in other words, about a third or a quarter of the embryo we put in only become a pregnancy. The rest don't. Yeah. So from a patient's perspective, that's not very good odds.
Yeah.
You know, you had to go through 4 times to get 1 pregnancy. So that's not good. So in order to improve that probability, the doctors will tend to put in more than 1 embryo. Just in case 1 fail, hopefully the remaining 1 will continue on. So that is why sometimes in IVF you get a twin pregnancy. Your second question is?
It's basically so the outcomes are just both can happen singleton and multiple
yes,
births.
that's right, yeah.
But how do single and double embryo transfers, as we just touched upon, how do these differ from another?
Yeah, okay. So if you put in if you put in 2 embryos during the embryo transfer procedure, you get 3 possibility. Yeah, there's still a possibility that the patient don't get pregnant.
Yeah.
Because both the embryo dies and unfortunately it's a failed cycle. The second possibility is one of the 2 embryo implanted and created a singleton pregnancy. And the third possibility is both embryos implanted and you get a twin pregnancy.
Okay.
So 3 possibilities here. In terms of the technique of doing the embryo transfer for 1 or multiple embryo, it's actually the same. Basically, the embryos are extremely small. 1 or multiple embryos can be loaded into the transfer catheter, and the catheter will be placed into the woman's uterus. So technically it's the same. It doesn't mean that I'm putting in 2 embryos, I had to do 2 embryo transfer. That's not true.
Okay,
Yeah,
so it can go all in one go.
All in one go. You can put in 3 in one go. I mean, that's not what I recommended, but technically that can be done.
Technically it can be done. Okay, okay. And what are actually the pros and cons of single versus double embryo transfer?
Yeah, well, the major advantage of putting more than 1 embryo is you want to improve your pregnancy rates. As I mentioned earlier, the typical implantation rate for a day 3 embryo transfer is about 25%. So the odds are 1 in 4. So if you put in more embryos, your chances of getting pregnancy will be higher. Yeah? It has been shown that if you put in 2 embryos, your pregnancy rate should be about 7 to 10% higher compared to a single embryo transfer.
The only advantage is there's a higher pregnancy rate,
Correct.
7 to 8% higher.
Correct.
Now this is a very good advantage, of course, but are there also any risks or complications associated
yes.
with the double embryo
Correct.
transfer?
Like any treatment, successful treatment, a high success rate comes with a price. There's a price to pay. The complication is you get multiple pregnancies. The risk of multiple, if you put in 2 embryos, the risk of multiple pregnancy is approximately 25%.
Okay, and does this also mean anything for health for the actual pregnancy itself? So for instance, premature labor or possible long-term health problems for the
Yes.
twin involved?
Yes. So to a lot of twin IVF patients, they think twin pregnancy is great. You know, I have 2 kids, 1 shot, I don't have to do it anymore. But sometimes a lot of people don't realize that twin pregnancy is a complication. It's a major complication in IVF for simple reasons. Because most twin pregnancy delivers prematurely. For example, twin pregnancy, 60% of twin pregnancy delivered triplets delivered prematurely. Yeah, the more babies you have in your pregnancy, the more likely you will deliver early. Yeah, and the definition of preterm labor is a pregnancy that deliver below 37 weeks.
Below 37 weeks. Okay.
Yeah. Why are we so worried about preterm labor? Well, very simply put it, the baby body and the organ hasn't attained full functionality. It hasn't reached the full maturation.
Yeah.
So a lot of organs are not working well. So these babies will require help in maintaining their body temperature, in fighting infection, they need help in breathing as well as feeding. And this is particularly true when the baby delivers below 28 weeks.
Okay.
And they will go through a very stormy recovery, and sometimes death occur. So not all babies survived.
Yeah.
Because when they deliver prematurely, the baby is not ready to come out to an external environment. They still require to be in the mother's womb. So therefore, they had to be admitted to a place called Neonatal Intensive Care Unit, or NICU. And they had to be there for at least about 1 to 3 months sometimes. Okay. And of course, this services is expensive and costly. Yeah.
So whereas twin or even triplet pregnancy may seem ideal, it actually brings a lot of complications in terms of health.
Absolutely. Okay. Not to say the stress the parents had to go through and the cost involved as well. And also, I forgot to mention just now is that of course, most twins do survive after all this medical intervention, but some of them survive with some long-term problems such as mental retardation, cerebral palsy, sometimes permanent loss of vision as well as hearing. Okay. So it can be quite long-term.
Quite long-term health. Right?
Yeah.
We actually have a live question coming in.
Sure. Okay.
There's someone who asked, I transferred 2 embryos, and one of my embryos split. Currently, I'm having triplets. May I know what is the risk of my triplets? Oh dear.
The risk is high. I mean, as I said, you have about 90% chance of a preterm delivery. So, and the risk associated with it, as I mentioned earlier, the risk of cesarean section is also very high. I don't know how many weeks you are currently. If you just diagnose this and you are still around 8 to 12 weeks pregnancy, you have the option of excuse me, doing a procedure called fetal reduction to reduce the triplets into twin pregnancy. Okay. That will definitely reduce your risk. I'm not saying that this is what you must do, but at least that is something you can consider. Okay, that's a very, very important piece of advice, I think. Yeah. We have another question coming up, which says, I've tried IVF twice, but I have OHSS for both IVF. Is there any way to avoid OHSS? Yeah, sure. I mean, this question is a little bit off the topic, right? But never mind, let's talk about it too. Nowadays, the stimulation regime for IVF is improved a lot. So first of all, you don't go for a high-dose stimulation. You will go for this protocol called antagonist cycle, which only involves about 10 days of injection. You will trigger your ovulation with a different drug rather than HCG, and you will certainly freeze all your embryos and put in the frozen embryo in your subsequent cycles. You don't put it in the same month. If you manage it correctly, your chances of ovarian hyperstimulation syndrome should be almost 0%. Okay. Oh, of course. I mean, I'm talking about the severe hyperstimulation. You will still suffer with a mild to moderate degree of ovarian hyperstimulation, which most people can cope very well at home. What the doctors are worried about is severe ovarian hyperstimulations. Okay. Okay. Yeah. So we've now actually discussed complications that can happen in twin or triplet, even triplet pregnancy. But what can we actually do to reduce the incidence of these complications? Yeah. The first thing that we can do is to put in an embryo called blastocyst rather than a day 3 embryo. Maybe let me explain a little bit about the difference between a day 3 and a day 5 embryos. Yeah, let's do a bit of biology. Yeah. Okay, I got a picture here. So this is a typical appearance of a day 3 embryo. It has about 6 to 8 cells in the embryo. Day 3 meant they fertilizes, the egg and the sperm fertilizes 3 days ago, and they have developed and differentiated into this embryo. These are early cellular development, and this embryo derives the energy to differentiate from the mother's eggs. The implantation rate of a day 3 embryo is about 25%. It's not very high, as I mentioned earlier. About 1/4 of the embryo will implant. This is a day 5 embryo. So you give it 2 days, and some of the good potential embryo will further divide into a thing called day 5 embryo or blastocysts. Blastocysts are very different. They have differentiated into 2 cell lines. You have a trophectoderm, you have an inner cell mass. This embryo will have a much higher implantation potential. The implantation rate goes up to about 48%.
48, so that's almost double.
Almost double. So, can obtain blastocysts. My advice is you go for 1 embryo transfer rather than 2.
Okay.
Because the potential of this embryo implanting is really high. You don't have to risk your treatment by putting in too many embryos.
Yeah.
That's one of the way of reducing multiple pregnancy.
Okay, so then indeed, since the implantation rate is also already so high, putting in 2 embryos is really not necessary anymore.
Yeah,
Okay.
that's right. Yeah.
And besides considering a day 3 versus a day 5 embryo transfer, there's also pre-implantation genetic screening.
Yes.
How can this technique be used to reduce multiple pregnancies?
Yes. In IVF, it's all about choosing the correct embryos. Yeah. As I said, human embryos are full of chromosomal defects, and chromosomes are things that you cannot see based on the appearance. It's like judging a book on the cover. You cannot see the content of the embryo. The chromosomes are very hard to be checked. Until recently, there's a test called pre-implantation genetic diagnosis, or PGS. And PGS allow us to map out the DNA and the chromosome of that particular embryo. So this PGS is done on suitable embryo during IVF before implantation. It will help us to siphon out the chromosomally normal from the abnormal embryos.
Okay.
So by putting in the normal embryos, you will expect a much higher pregnancy rate and a much lesser miscarriage rate. And right enough, implantation rate after a PGS embryo is higher. It's about 70%.
70?
Yeah.
Wow.
So it keeps going up. So that's why if you can get a blastocyst as well as a normal chromosome blastocyst, the advice is to go for 1 embryo transfer.
1 embryo transfer. Okay.
Yeah.
We actually have another live question coming in.
Okay.
It says, I did 2 IUI failed. My tubes are fine. I have another 3rd IUI. What steps can I take to enhance the chances of my IUI?
Well, you have to understand, IUI is a simple treatment. Yeah. Every time you do IUI, you have about 15% chance of conceiving. 15%. In opposed to IVF, where you can get about 50 to 60% chance. So these are the inherent things that come with IUI treatment. You may do 3 to 4 IUI and it may not work. But if that's the case, you really have to move on to IVF, unfortunately. I mean, the way of doing IUI is very simple. It's very similar worldwide. And everybody is getting around 15-18% success rates. You are not going to increase that furthermore by doing some special thing to it.
Okay.
It's often limited.
So if you notice IUI is really failing too often, the next step, unfortunately, really is to go on to an IVF.
Correct, yes. Okay. Unfortunately, that's the case, yeah.
Okay. So before we talked about pre-implantation genetic screening and day 3 versus day 5 embryo transfer. Now there's also embryo freezing to reduce twin pregnancy. Could you perhaps elaborate on this?
Yeah. Embryo freezing is perhaps one of the most important inventions in IVF. It gives the patient and the doctors the flexibility of putting in embryos at a later date. So for example, if a woman has a good ovarian reserve and she managed to have 5 blastocysts, instead of putting all 5 into the uterus one time, we can put in 1 and freeze the other 4.
Okay.
So that gives the patient the assurance that they still have some in storage. They give them additional chance in the future. And also frozen embryo transfer is much cheaper compared to going through a fresh cycle again.
Okay.
So definitely, if you have good number of embryos, it's not wrong by just putting in one embryos. Yeah, and you can do it slowly, one at a time.
One at a time. Okay. Okay. Then, in terms of there's an interesting question here, which is as well that often there's the notion that twins can still happen even though you transfer only one embryo. Is this correct, or is this a myth?
Well, that's what the question was mentioning just now, isn't it? Yeah, it's interesting, isn't it? You put in one embryo, or you put in two embryos, or sorry, you put in one embryo, you get twins, you get two embryos, sometimes you get triplets. That's what the question was just now. Well, it can happen. Sometimes one embryo can split into two, what we call identical twins or monozygotic twins. So one embryo, somehow when they develop, is split into two different cell lines. So it gives rise to two babies, but with same physical appearance, gender, same blood group. This is what we call identical twins. Chances of it happening is about 1%.
Okay, so the chances are very low.
Yeah, are very low. So, for example, take that question as an example, where she had put in two embryos. I guess one of the embryo has split into two.
Yeah.
So that's why you get a set of identical twins and another one non-identical twins. Yeah, so you get the triplets.
The triplets. Yeah, indeed. Wow. Okay. So indeed, even after transferring one embryo, twins can still occur. Now, there's another notion called the vanishing twin syndrome.
Yes. Yes.
What is this, and how can it happen?
Yeah. So it's actually quite common. Vanishing twins is actually quite common in multiple pregnancy. It happened in about 30%. When the patient comes to see a doctor and do an ultrasound scan, usually about 5-6 weeks gestation, the doctor detected 2 pregnancy sacs, 2 babies, 2 heartbeat, right? Yeah. So they come back for another follow-up a few weeks later. Now, the scan says there's only 1 baby, 1 heartbeat, 1 pregnancy sac. So the mother will ask, where's the other baby? Has it gone? Yeah. Well, actually, it hasn't disappeared. It's just that one of the twins is unhealthy. The fetal heart stopped. Yeah. It's almost like a miscarriage. But fortunately, the remaining one continue on. Okay. So this is what we call vanishing twins. Vanishing twins. We don't really quite understand how it happens. I suppose it could be due to the abnormal chromosome in one of the pregnancy. It's a little bit like a singleton miscarriaging. Yeah. But the fortunate or the unfortunate thing is that they have 2 pregnancies, so at least 1 will continue on. Okay. Yeah. Okay. So at the end of it, hopefully, patient will still have 1 healthy baby. Hopefully, indeed.
Okay. We've got another live question coming in, which says, I did an IUI and failed now. I'm doing IVF on this month, the 15th. I'm ready to transfer an embryo. After transferring, what should I consider?
Actually, try to live your life as normal as possible. Try not to get yourself too stressed out. The layman way of telling you will be, oh, you go and take 2 weeks rest, you stay in bed, you hang yourself upside down, you don't move, then your embryo will implant. Actually, that's not true. Okay. These are grandmother's tales. Huh? Yeah. So, in fact, study has shown that if you continue your life as usual, the circulation, the normal activity will actually help the embryo to implant. In fact, study has shown, in fact, quite a big study has shown that a woman who continue life as usual has a higher pregnancy rate compared to those who stay in bed. Okay. Yeah, contrary to the old belief. So try to stay active, but of course I don't mean that you should go for overnight, do overtime work or go for marathon, but you should just still maybe do half-day work, do some cooking, mobilize at home. Try to take the stress off your mind, yeah? Because a lot of people get extremely stressful during the 9 days wait. Yeah. Yeah.
So the advice here really is to just behave normally and
Yeah,
do what you always
absolutely, absolutely.
Okay.
Yeah, yeah.
Another question. I did IUI and IVF, but it never stick. Why doesn't it stick?
Well, I partially answered that question just now. Of course, as I said just now, IUI is a very simple treatment. The fertility or the pregnancy rate is about 15%. IVF is higher, but it's also not 100%. The reason why the embryo doesn't stick in IVF is partly because of the abnormal chromosomes. A lot of embryos are chromosomally abnormal. Yeah, abnormal chromosome embryo will not implant. It's not to say that your doctor purposely put in an abnormal embryo. As I said, sometimes looking the embryo from the outside, you can't see the chromosomes.
Yeah.
You can only see, oh, this is a nicely developed embryo, it looks good. But what is inside it, the chromosome, we cannot tell.
We can't tell. Yeah.
Yeah. So sometimes you may have to do IVF more than 1 time, 2 times, 3 times to get that healthy embryos. Yeah. And also the other thing that I like to mention is it depends on the age as well. IVF pregnancy all depends on mother's age. The reason why I say that is because if you are below 35 years old, 1/3 of your embryos are chromosomally abnormal. But if you are above 40, the figure reverse. Only 1/3 of your embryos are normal.
Oh, okay, wow.
So age does matter. So yeah, there are many factors in this, but most likely it's due to chromosomally abnormal embryos.
Okay. Okay.
Yeah.
Interesting thought of this. Now, Kale Fertility Center itself also conducted an in-house study on the topic of multiple births in IVF, and one of them covered whether information about the risks of double embryo transfer actually changed patients' desire for a double embryo transfer. Could you perhaps briefly elaborate on this?
Yeah, sure. For the last 10 years, the whole world is trying to educate patients about risk of multiple birth and the benefits of putting in 1 embryos. So we've done an online study as a self-administrated study where patients are asked to fill in their questionnaires. They fill in the questionnaire before and after they were informed about risk of multiple birth and so on. So interesting, the result is quite interesting. 89% of the survey shown they understand the risk of twin pregnancy, and about 65% agree that ideal IVF pregnancy should be singleton, shouldn't be twins. But despite saying all that, about 85 to 90% of people surveyed still prefer 2 embryos to be transferred. Okay.
Do you have any idea why this is? Why people still go for the twins?
I think infertile couples are just so stressed for the last so many years. They just want to achieve a high pregnancy rate. They've been waiting for this pregnancy. Pregnant first and consider the consequences later. They deal with it at a later stage. I just want to get myself pregnant first.
Yeah, so
I think that's really basically the mentality. And also, there's also some mentality that I want to get pregnant with twins, pregnant 1 time, deliver this baby healthy, and that's it. Close shop. I don't have to do this anymore.
Yeah. Okay. Then it's the job is done.
Yes, the job is done. That's right. That's right.
We've got another live question coming in. It says, "What's the cause of an abnormal chromosome, and how to reduce the chance?"
Unfortunately, as I said, it's very much age dependent. Women's age dependent. As the woman age, their chromosome in the egg will go through this thing called aneuploids. That means the number of chromosomes is either reduced or increased. So you can't avoid it, especially as you get older. The test that I mentioned just now, the PGS, will help to detect it, but we cannot eliminate it.
Okay.
Yeah.
And
Yeah, it happened by chance, unfortunately.
Happens by chance.
It happened by chance. For example, like I said, if you are younger, you still have a 30% chance of having abnormal embryos. If you are 40 and above, 60% chance you're having abnormal embryos.
Okay.
Yeah.
Okay. And another live question that just came in as well is, normally one person, how many times can you do an IVF?
That's a very difficult question to answer. It really depends on the cause of infertility. Let me give you some extreme example. Let's say a 45 years old woman came, went through IVF, the whole thing went bad. She produced very few eggs, very poor embryos, and she doesn't get pregnant. Those patients will tell them to stop. No point trying anymore. Save the money. And perhaps consider adoption or egg donation. The other extreme end example will be someone who's younger, produce 15 eggs, maybe 5 blastocysts. They put in the embryo but don't get pregnant. Those patients, I will tell you, don't give up. Yeah, chances are still very good. As I said, maybe just bad luck. There's still plenty of good quality blastocysts. Your chances of success is still very high.
Okay.
So really depends on individual. I really don't have an answer to the number to give you 5 or 10 or whatever. Yeah, there are 2 reasons why people stop. One is they find the treatment too expensive. They can't afford it. Or 2 is they get too stressful. They find the treatment too stressful. These are the 2 main reasons. Okay. And third, of course, could be medical reasons, like the example I gave you just now. Yeah. So
it really all depends on your individual.
Correct. Absolutely.
Maybe as a closure and to wrap up the Facebook Live, what advice would you give to all couples out there who are considering a single versus a double embryo transfer?
I think you really have to weigh up the pros and cons of getting high success rate and getting also the twin pregnancy. And if you are younger, below 35 years old, this is your first IVF treatment. If you manage to get blastocysts, and if your center offer freezing facilities, and you even go as far as a PGS to exclude chromosomal abnormality, I would advise you to go for only 1 embryo transfer. Okay. And if you still consider doing multiple embryo transfer for whatever reason it may be prepared for the financially, psychologically, as well as physically about bringing up twin pregnancy. It's not as easy as it seems. There's education costs involved, medical expenses, and so on. And that will go on for the next 18, 20 years. It's a long time.
Wow. So educating yourself, weighing up the pros and cons is really important.
Correct. It's a big decision to make.
Okay. Thank you very much for that, Doctor. We've actually reached the end of our Facebook Live session for today. I think it has been very informative, and I hope everyone has been able to get their questions answered, but also to learn something new today. Thank you, Dr. Paul.
Thank you.
Thank you to our dearest viewers for your brilliant questions, and also thank you for watching. Before we leave, I'd just like to say to our viewers that should you still have any additional questions or whatsoever, you can just send a message to our Facebook page, KL Fertility Center. With that having said, Dr. Paul, thank you so much again for your time, effort, and of course also your knowledge. And thank you to our dearest viewers for watching. See you next time.
See you. Bye-bye.